Well, thank you, everyone, for joining, and thank you to our speaker for today. So, Dr. David Velasquez is an internal medicine primary care resident at Brigham and Women's Hospital. He holds the distinction of being the first person in history to have obtained graduate degrees from Harvard Medical School, Harvard Business School, and the Harvard Kennedy School of Government. Throughout his career, he has collaborated with organizations across the public, private, and nonprofit sectors, all dedicated to enhancing healthcare access and delivery for vulnerable populations. David is a passionate advocate for these communities, contributing to the discourse through his writing and research, which have been featured in prominent publications such as the Boston Globe, Scientific American, STAT, Health Affairs, JAMA Health Forum, and the New England Journal of Medicine, Catalyst, and others. He graduated summa cum laude from University of Southern California with a BS in human biology, and was raised in Los Angeles and the Antelope Valley of California as the son of immigrants. So thank you so much for giving your time to be with us this morning, and I'll let you take it away.
Thanks so much for the introduction, Lucia. I'm happy to start wherever, Lucia, if you just want me to give like a general overview of who I am and where I come from. So nice to meet everyone online. Thank you for coming on a Saturday morning. Maybe not your ideal Saturday morning, but hopefully it's a helpful one. Um, so as mentioned, my name is David. I am currently an internal medicine resident physician at the Brigham and Women's Hospital. But there was a lot leading up to where I am right now. So I was born and raised in the Los Angeles area and really all throughout Southern California. My parents immigrated from Central America in the 90s, and we grew up very low income. We kind of bounced around because of that. My parents were asylum seekers, and so it took a long time for them to, receive their permanent resident cards. And so during that time, we were living in family shelter homes, in very small apartments, and also in very small homes. And so moved around a lot, ended up in the Antelope Valley of California, if any of you are familiar with that, the Palmdale, Lancaster, Rosemont area, where I spent most of my like elementary, middle school, high school years. Loved to run in high school. I was a cross-country track runner, and basketball player as well. And then I went to college at USC, so I kind of stuck around the Southern California area, got to be close to my family, go to a great institution. And that was when I decided to be pre-med. There is so much that I can say about my pre-med journey, and I'm sure Lucia and others will have questions about it. But just quickly right now, and spent 4 years at USC, enjoyed my time there. It was definitely difficult at first, being, the first person in my family to go to college. I didn't really know how to do college. I didn't know what to focus on, how to study, and all that. But as time went on, I kind of learned and got better at doing college. Um, and thankfully, by the end of that, I was accepted to Harvard Medical School in 2017. And so came out here to Boston and have really been here in the Boston, Cambridge area since then. Went to Harvard Medical School started in 2017, took some time off to study business and policy, as mentioned, because I got really interested in understanding the policies and the systems that affect people's health. We know that in the clinic, we can do a lot for people, but we also know that we can do a lot for people outside of the clinic, from the policies that our government sets to, the policies that our hospitals and our health system set. And so I wanted to understand those a little bit better, which is why I took those 3 years away from med school. Then I came back to med school, finished my last year, and then started at the Brigham and Women's Hospital for internal medicine this last June. So that's a little bit about me, but I'm more than happy to answer any questions that anyone has, including you, Lucia.
Perfect. Thank you so much for that overview. And I guess we can kind of take it back to start about maybe you could speak to what first made you realize that you wanted to pursue medicine as like a career path. And then, yeah, why don't we start with
Perfect. Great question. Um, a couple of things. Well, I'll preface this by saying there wasn't one moment where I said, "Oh, this is it, and this is why I want to be a doctor." For me, it was really when I was in high school And I started thinking back, to the last, I was what, 14 around then, to the last like 14 years of my life or so. And I noticed a few things. One, I noticed that some of our closest friends and family members unfortunately did not have access to healthcare. That included my brother's godmother, who we all called our Dia, who unfortunately passed away at a very young age from breast cancer because she didn't have a primary care doctor. She couldn't access services before the cancer, really spread throughout her body, and from neighbors to who did not have a doctor who can help control their diabetes. And I saw all these things and I started reflecting and wondering, like, why is that happening? Can we do anything about that? And at the same time, right before high school, my family and I were living in a motel in Rosemont, California, and my mom got really sick. She had probably a pneumonia or some respiratory illness, and we couldn't do anything about it. We couldn't even take her to the hospital because my dad needed the gas to go to work the next day. And so I saw a lot of these problems affecting my family, those closest to us, and in high school, I said, maybe I can do something about this, right? Maybe I can be that doctor who kind of goes back to these communities and helps them and make sure that, when they need a doctor, they have one. And so that's when the idea really came to mind. But the thing was, I didn't think I could do it. I didn't know how to do it. No one in my family had been a doctor. I didn't know any doctors. We barely saw doctors growing up as kids. And so while the idea was there, it wasn't something I had committed to yet until college. When I got to college, I initially, didn't really believe that I could be a doctor. And so I said, okay, what's like a safer route? I'm already in college. Maybe I can become an engineer, graduate in 4 years, and then get to work, help my family. That felt like a safer path rather than the path of let me do these 4 years, apply to med school, hope I get in somewhere, and then after that, hope I become a resident and whatnot. Um, but I had this experience during my first summer, right after freshman year of college, where I was volunteering at a hospital in Glendale, California, and I worked with a lot of different patients. And I'll give you one quick story where I was in the emergency department. It was my first day as this like new intern, student intern. Um, and the nurse came up to me and he said, "Hey, are you the new intern?" And I said, "Yes." And he said, "We're getting a patient in full arrest, meaning he had no pulse. Can we get you on CPR?" And I was 19 at the time. Like I didn't know anything. I'm like, "You want me to do CPR?" Like I had done my training, but that was it. Um, and he's like, "Yes, we need hands." It was a Saturday morning, so we were pretty understaffed. And then I went in. I was the second person to do CPR on this gentleman, and we kept going round after round. And eventually, he got a pulse, and we sent him to the intensive care unit. Um, and in that experience, after that, I realized, wow, like in this field of medicine, there is a lot that we can do. Even as someone that is 19 years old and has very minimal skills, like I can do something to help this person in front of me. And I imagined at the time, like what I could do, like if I were trained as a physician. And I think, I connected that with my community and knowing that they didn't have access to healthcare. And that was really what sealed the deal. It was then that I said, okay, I think this is it. I think I want to be a doctor.
Yeah, that's great. And I can see how that progression of like all those moments together was what brought you to that kind of conclusion. And I can also probably see how your experience as well led you to want this like interdisciplinary career. So, can you speak a little bit to that? How did you decide to pursue these other degrees? And what did the logistics look like of doing that in medical school?
Yeah, great questions. So to answer your first one, what led me down that path? Um, I had a similar time of reflection when I got to medical school, as I did before when I started thinking about, the last 21, 22 years of my life. And I realized, yes, I want to be a doctor, right? I want to be at the bedside. I love sitting with patients, hearing their stories, being able to diagnose, treat, help them feel better. I love that. But I also realized when thinking back, right? Like it wasn't just the lack of access to healthcare that was affecting my family and my community. It was that we didn't have stable housing. It was that we were food insecure for years. It was that transportation was a big issue, right? It was that my parents were only being paid minimum wage, or sometimes less, during their jobs. And so it was a lot of these other things that we don't typically think about when, someone says healthcare, that came to my mind. And so in 2017, I started asking myself, all these other things are affecting people, not just people that I love, but people that I don't know who are similarly struggling. Is there some way for me to understand these problems more and do something about them? And so I had that thought for a couple of years. And then finally in 2019, 2020, I kind of made the plunge and I said, I think I want to take time off from med school, to do that, to study the policy and the business, in order for us to be able to change the health system, not just the healthcare system, but really the health system, which includes so many more things beyond our doctors and our and our hospitals. Um, and so that's kind of how the progression of that came about. Um, as to the logistics part, thankfully, so many of you, whoever wants to go to medical school here, I know you can do it. And when you are in medical school, you will see that, often during between the third and fourth year of medical school, you can usually take like a year off to do research or to do an MPH or a different degree like that. Um, I had to take a little bit more time off because I wanted to do both of these programs. And there was already a 3-year combined like MBA, Master's in Public Policy program that I wanted to apply to. I logistically just, short story, I had to speak to, the deans at my medical school. I had to tell them like why I was interested in the program, my plan for how I was going to maintain some level of clinical skills during the 3 years, and how I would come back and reintegrate into medical school. And I think that they gave me the opportunity because, I had thought a lot about it. It wasn't just like a decision that I made out of nowhere saying I need these 3 years. It was something that, I really wanted to do and that I was passionate about and that I believed, could help me, be better prepared for the future.
And I guess, can you speak a little bit to how that experience went? What were some surprising things maybe about, like, after you came back to medical school after that 3-year program? Was there anything surprising, or like did that change your perspective in any way?
Yeah, well, yes, I mean many things from, the obvious things such as coming back and forgetting a lot of what you had once learned. That was tough, but it comes back. It definitely comes back. It took me like a week, a little over a week to be in the hospital, to be on the floors, to just understand like how to be a good medical student. Um, so that maybe wasn't surprising to me, but it was something that I very much noticed. I think the other thing, right, is I went to business school, policy school to understand like how our systems work and how policy works. And coming back, I think you're a little bit more attuned to all the issues. You come back and then you see patients not getting the medications that they need because of some amorphous reason. And I think having been in the policy world, you understand that a little bit more, right? Oh, it's because, Medicaid or Medicare won't cover this, or private insurers won't cover this, and so forth. And so I think you're able to connect the dots a little bit more. Um, and understand like why patients suffer from lack of access to certain services like medications or the prescriptions, and so forth. So you see a lot of those things, I think, once you start thinking about the real issues.
Yeah, so going forward, how do you hope to kind of intertwine um, these different aspects of your training into your career?
That's a great question, and if someone has the answer for me, I would love to hear it. I'm still figuring it out, is the short answer. I definitely want to do policy, in the future. Like I want to work with an organization that is, mission based, that really cares, about the people, and people puts people first. And at the same time, I hope to be a clinician, that is seeing patients, in hopefully an underserved community. maybe in California where I'm from, but maybe elsewhere too. There's a lot of need across the country, and so we'll see. It's a lot of TBD at this point. Right now, my objective is to become a really good clinician while I'm in residency.
Yeah. So kind of hopping back to your pre-med experience, can you speak to some other like activities or things you were engaged with at USC or, during that period that that you felt make a significant difference in your journey?
Absolutely. A couple of things stand out to me. The first is I think I was in my sophomore or junior year, I co-founded an organization that essentially put together health fairs in the like greater Los Angeles area. So we worked with elementary schools in particular around like downtown LA, East LA, and so forth. And we would email, like cold email physicians, dentists, like all the different like healthcare professionals, advocacy organizations, and so forth, so that they can come like on a Sunday, have a health fair, and we would invite people from the community. And that was really special to me because those are, while it's not, the best solution, right, to a lot of the problems people face, like there are definitely structural things that we can do to improve the lives of people. It was something that we were able to do as college students for the community, bring those services. Like we had a line from, the gymnasium of one elementary school stretching to outside of the gymnasium because people were trying to get their eyes checked because they just never got their eyes checked and they had eye issues. And then right next to that booth, we had an organization giving out free eyeglasses that were basically essentially fitted to a person's vision. And so that was, I think, one of the most meaningful things that I was able to do. And the reason, it was meaningful, is because it was like we had dealt with those issues before. And it meant a lot to me. And I think, when you think about your college experiences, you want to make sure that you're doing things that mean something to you, not that you're just doing something to check the box, which is often, something that I think pre-med students can kind of jump into, because we're trying to get to the next step, which is medical school. The other thing that I did that I really loved, was some teaching. So I loved to teach. I taught organic chemistry when I was in college, and I know it's a course most people hate, but I really liked it. And I was able to teach it for a couple of years at USC, and I really enjoyed it. And I think it, definitely helped me learn how to be a better teacher, like a better instructor, which I think is an important skill for medicine in general. Whether you're a med student, teaching um, maybe your other medical students or people or student shadowing, when you're a resident teaching medical students, and so forth and so forth. Um, and then the last thing that I'll quickly point out is research. Um, it's I save it for last because when I was in college, I had this idea that we had to do research in like the basic kind of hard sciences, and that was what I needed to do. I was wrong about that. You can do research in like anything that you're interested in. It can be policy, it can be basic science, it can be clinical science, it can be anthropology, it could be sociology, like whatever it is, you can do that. I didn't know that at the time. And so I had a bunch of different research experiences from the basic science wet lab experience to the clinical experience, to the dry lab experience as well. So I had a number of them, but never really fell in love with it because I don't think I had found like the right topic. And that was, a mistake on my end because I just didn't know what I was truly interested in at the point and what I could do and what research really meant. Oh, I think you're on mute, Lucia.
Thank you. Yeah,
Yeah.
I think a lot of pre-med students can probably resonate with that and kind of navigating. We have one question from an attendee about OChem, that you mentioned tutoring and teaching OChem. What did you see many students struggling with, and what do you think really changed their performance in that class? So, if you have any advice.
Yeah. Yeah, I mean, I think a general piece of advice. I found that many of the students who struggled were focused on memorization. They were focused on memorizing all the chemicals, the compounds, the reactions, And that is really hard to do because there are so many reactions and compounds and chemicals that you can memorize. What I found the best students were doing was trying to understand why a reaction was happening, right? Why is it that this compound reacts with sodium hydroxide in this way? Like, what is it about these two chemicals? It's probably an acid-base thing, right? The base is is reacting with the acid and therefore creating a compound from that. And so just like thinking through that, like why is this happening? Like, why does this work? I think will really be beneficial.
Yeah, thanks. And so we have another question asking about how you like what helped you get through some of those obstacles or difficult periods in your life, such as, dealing with homelessness and yeah, if you could speak to that.
Yeah, I'll say a couple of things. The first is that it was not easy. And when those experiences happened, it was really hard. And, I can't tell you that when we were living in the motel that I was thriving. Absolutely not. I was sad. I was ashamed of like the situation that my family was in. I didn't really talk to anyone because of that. Um, and so, you know, those are really hard experiences, and I think we need to acknowledge that. And there probably isn't like a best way to get through them. Later on, when I was like in college and in med school, my family still dealt with a lot of issues from, my dad being hospitalized to my parents losing their home again and things like that. And I think I was better able to manage them because one, like I had good people around me. That was a mistake that I made when I was younger. Like I didn't talk to people because again, I was embarrassed, ashamed, and so forth. I didn't think that others would understand, and maybe no one could fully understand, right? Outside of those that are experiencing it. But people want to understand, especially your close friends. Like they want to know what you're going through. They want to help. But you have to take that first step and talk about it. And so I think would be, one piece of advice, at least looking back at the last couple of decades now, of when things were a little bit better, what happened? I had friends, I had a community. Um, and I think the other thing is, just my mom is super like optimistic, and I think I get that. I get my optimism from her. And so, it was like when these things happened, like my mind wouldn't, or at least later on in life, it wouldn't go to like it's over for us, like this is a disaster. It went more of like this is really hard, and I like don't know how I'm going to get through this, but I'm going to get through this, and we're going to do it together. And I think that kind of mindset definitely helped. Of course, the mindset alone can't solve everything, but it did help, especially later on, like when I was in med school and such, when I was going through difficult situations, just having like a more optimistic kind of thinking helped.
Yeah, and I think speaking about like a support system definitely is important throughout your whole journey, starting when you're young and then into medical school and the rest. So we have
Absolutely.
kind of another question about navigating the application cycle as like a first gen pre-med. Um, is there any specific resource or like specific mentor who was able to help you accomplish that successfully?
Yeah, great question. So yes and no. It's funny because even when I was applying to medical school my junior year of college, like I had never done that before, obviously, and no one in my family had. So I didn't know exactly what to do. But what really helped, and what I would encourage you to do is my friends actually, which like many of us probably don't think of, right? We think of like who is like older than us, who has done this before. But I found, and in college you're around a bunch of different people, that sometimes like your friends know a little bit more. And it's maybe because, they like know a doctor or they had a family, or a doctor in the family or something like that. And so I can tell you, like, there was one friend in particular who like was really helpful through that process, just by talking to him. And like when I sent him my personal statement, for example, he told me like this is not good, and I needed to hear that, honestly. And when I looked back, I said, "You're right, this is not good." Uh, but I didn't know like what a good personal statement looked like. I didn't know, what resources to use. Like he told me, oh, Princeton, Kaplan, etc. Like here's probably what you want to do. So that's one source, like your friends, like actually again, want to help you. And many of them have, assuming you come from a similar background as I do, many of them have more experience like in this world than we do. The second thing, and I know a lot of colleges don't offer this, but counselors like and those offices, we definitely had one. I found them helpful. They weren't the like most helpful resource to like personalize their advice. But just like big picture stuff, like they were helpful, or just like handing out resources and things like that. So those are the two that I would point to right now.
Yeah, I'm sure those are very helpful and thank you to everyone putting questions in the chat. We're going to keep pulling from some of those. But so someone actually, Gabby says, hello, I remember you from USC and being my student instructor. It is inspiring to see you doing all these amazing things. Would you have any advice on the MCAT and how to get a high score? So,
Yeah, well, first off, hi Gabby. It's nice to hear from you. Um, yeah, so the MCAT, I think there probably needs to be like a longer discussion about this. But a couple of things that I will say. One is practice problems, practice problems, practice problems. I think those are the most important resource. Whether I think nowadays people are using UWorld for the MCAT as well. We use it a lot for like our med school board ex or licensing exams. So I would say get your hands on practice problems. I do think like content review is very helpful, right? Like a reading the content review from Kaplan or Princeton or some other resource. But really, the way you learn is by doing those questions and getting them wrong, and like reading about okay, what was wrong in my thinking. And so that I think is my biggest piece of advice for the MCAT. And the second thing is a really good study schedule. I have met people with various different study schedules. And I think you need to tailor it to you. And obviously, this depends on your situation, right? Like, do you have a full-time job? That's going to obviously limit how many hours you can put into studying per week. Or do you have like 2 months off where you can kind of just study like for X amount of hours per day? Um, Whatever it is, like come up with structure to your plan. Say, I'm at these 3 months, I'm going to do 8 hours per day or whatever it might be. And then I'm going to take it at the end of that. The last thing I'll say is similar to the first one, the practice tests. Practice tests are like great to kind of understand where you are. The AAMC practice tests tend to be, I think, a better gauge on where you are. The others, like often students will score lower than where they actually are. So it's like a good gauge. Like they're probably a little harder, like the Kaplan Princeton test and so forth, than the actual test, but definitely something helpful to use. So I think hopefully that helps, but definitely depends a lot on your situation.
okay, thank you. And so speaking to some of the other components of the medical school application, do you have any general advice about timing or, um, you know, getting all the secondaries and then interviews and how to like, or how to create your school list? Anything that you think might be helpful advice?
Yeah, the first and even before all that, I think the one important thing to think about is like your application itself and what the application says about you. I think going back to one of the comments I made earlier, sometimes we make the mistake of like checking the boxes on certain things. Um, and like oftentimes we will do things and we think we're checking the box, but we're actually doing them because there's a good reason behind it. We just maybe haven't thought about it yet. But my point is like you want to make sure that the reader, the admissions committee, that they know why you did X activity, Y activity, Z activity, right? Like you want them to know I did this because, I am super passionate or interested about this thing. And here's what I learned from it. And then at the end of the day, I think you also want the admissions committee to look at your entire application and say, okay, like this student is clearly interested in social justice and becoming a doctor, or this student like loves the science behind like clinical medicine, and you can see it because they did this wet lab stuff. They like love their biology class or like whatever it may be, right? So think about like what does your application say about you, and does it say what you want it to say about you? So that's I think just before even thinking about applying and everything. The In terms of like the logistics around timing and so forth, it's very helpful to apply early. You probably have heard this from many people, but apply early. Usually, the application opens like sometime in May, and you can submit sometime in June, early June. Um, Make sure you do that. It's okay if you're not right on time. You'll just get interviews a little bit later on. Um, and then the secondaries will come. And definitely, I guess one quick piece of advice is you don't want to take too long to respond to secondaries. So basically the first one you get, you kind of want to, if you get, let's say, like five, right? You want to make sure that you respond to the first one before you respond to the last one. Unless you're really not interested like in that first school and you kind of just applied, then that's fair. But if you are interested in it, then make sure your turnaround time is on the quicker end, like within a week, I would say, of you getting a secondary. Um, and the good thing is you can reuse a lot of like the anecdotes and such, right? Because many of them ask very similar questions. And then there's like the interview stage where you want to make sure you prepare. What does that mean? It means mock interviews. It means like asking, you know, your friends or upperclassmen or whomever it is that is in your corner to ask you questions. And the one question or the couple of questions that you definitely should have an answer for are one, why do you want to be a doctor? Um, and then two, tell me about yourself. Like those two questions, like make sure you have not an entirely memorized answer, but know like what you want to touch on, right? For the second one, tell me about yourself. You want to make sure you're saying things that you want to talk about more during that interview. If they say that in like you are really, I'll use myself as an example. Like when people would ask me that, I'm like, my upbringing really influenced a lot of what I did in college and a lot of what I want to do. So I would say, look, I'm from, Southern California. Like my parents are from, Central America, and they grew up this way, and I grew up this way, and that influenced like, a lot of what I do, and that opens room for them asking questions about that stuff. So you can kind of pick things in that answer so that you can elaborate on later. And then the why do you want to become a doctor is a very important question. And the one thing I'll say here before wrapping up on this answer is uh, our advice as I was a tutor at Harvard College, so I would talk to a lot of pre-med students, and I was on a committee, where we were talking to a lot of students applying to medical school. And, we all kind of agreed that that answer should have a component of patient care in it. What was there like an experience that you had either in college or after college where you worked with a patient? It doesn't have to be direct patient care, right? It could be you were interpreting or you were in EMT or a scribe or something, but a situation in which you helped someone else or you saw someone else being helped that really influenced like your decision to become a doctor. That's, I think, really important, like bringing up the patient themselves. Like you can say, oh, I want to be a doctor because, where I come from, we didn't have doctors and so forth. Like that's super important if that's true for you, and you should say it. But you should also then connect it to like more recently, here's what I've seen, in the hospital or in the clinic or, in my neighborhood, and here's why I want to be a doctor.
Yeah, thank you. That's all very helpful advice, which I know we have people throughout all stages of their pre-med journey and their application cycle. So maybe that's pertinent to people right now as well, going into interviews and um,
I think the important thing is also like, you can go down the street, you literally can go two exits and be in an underserved area. You don't need to do these massive, you know, and the thing is, and you have to be good at the small things. You have to be perfect at the small things in order to be good at the big things. If you say, hey, I want to go work I want to be a primary care doctor in an underserved area, but you've never been in an underserved area. It's kind of like saying, I want to go win the Olympic medal in the marathon, but I've like never ran a 10K, a local 10K. So I think like you got to be able to do those steps, to get to that point. And I mean, in anywhere in the US, I don't think that you don't need to be that far to go in communities that need help. If you can translate in a certain language, there's a lot of things you can do. One of my favorite things that I love to do is teach citizenship classes. People that need to do that, and I speak a different, I speak two different languages, so I love doing that. It's like one of my favorite things to do, and as an immigrant, it brings me like joy to do it. And it's not health related, but it like I do it, as much as I can. So yeah.
Yeah, no, thank you, Juven. That's definitely, I think, speaks to that, what you were saying as well, the passion that you should have and feeling that sense of meaning behind the things that you do. Um, and I think that also connects to like if you have a cultural or any sort of connection with your community and the community that you're helping, that definitely is impactful. So, kind of off of that, did you experience like a culture shock moving from California to the East Coast? And I mean, obviously you've stayed there. So how did you navigate that? Or what were some aspects of that experience for you?
Yeah, great question. The short answer is yes. It was very different, particularly being in med school at Harvard itself. I think that said, the transition from high school to college for me was actually like a lot more of a culture shock. I think college exposed me to various different worlds, various different people, cultures, and so forth. And so I like had that huge culture shock my first year of college. And then coming to med school, it was just like a little bit more, you know, meeting a bunch of different folks from various different places and being in a new city itself. I had never lived outside of California beyond one summer where I did research in St. Louis. And so I, was in a new city, and that was different, and it was cold, and like actually cold, and snowing, and we got a little bit of that in the high desert where my family is, but not a lot of it. So there are like things like that, and where I was my first year, Longwood, it's the Longwood medical area. It's like all medical. You walk into a coffee shop and you'll see people in like white coats, just like ordering coffee. You'll see like people in scrubs, just like sitting down, like having a meeting. Um, we saw none of that near where my parents live. Like if you found a doctor, like that was a unicorn. And here, like that just wasn't true. And so that was, I think, like the biggest culture shock coming here and being in the super dense area of healthcare providers, unlike anywhere else I've seen before. Um, so that, and like the way that I got accustomed to that again was like talking to folks, right? Like telling them about like here's like this cognitive dissonance that like I'm feeling, that I'm experiencing. Like when I fly home, it's an entirely different world than when I come back to Boston and to Harvard in particular and live in a very different world. And during the COVID pandemic, like that was super stark to me, right? Like going home, where my parents like basically couldn't do much. We didn't have access to much. It was so hard for them to get COVID tested. There were long lines. And then I come here, and I was living at one of the Harvard dorms, and they had dropped off like COVID tests like in front of my door. Like they were like getting meals prepared for all the students that were going to start school soon. And the two worlds were just very different. And so that's kind of, the culture shock that I experienced here, but able to process that, I think, by reflecting on it and by talking to those close to me.
Yeah, no, I can definitely um, see how that also probably impacted your perspective and wanting to address like the policy aspects and all of that. Um, and so we have another question. If you have ever felt imposter syndrome or dealt with anything of that nature.
Oh yeah, absolutely. And I think most of us do, even though those like who might not appear that way, like definitely have or are currently experiencing it. Um, some people are just better, right, at not showing that. For me, I mean, I felt it many times during my life, but I really felt it when I went to college. And this is probably more familiar to many of you. But like when I got to college, I was looking around and I was like, I does anyone come from where I come from? Like, I didn't see that many people who looked like me. I didn't see that many people who were from where I was from or who had the same experiences that I did. And then the one thing that I did hear, however, were like the number of AP classes that others had taken, or the number of SAT, subject exams that they had taken, and things like that. And I was like, dude, like, that's crazy. Like, my high school barely offered, I don't know, 3 or 4 like AP classes, and even then, many of them were getting canceled like year after year. Um, and so that I think really like made me feel that imposter syndrome, and I questioned so much like whether I belonged at a place like USC. um and I actually, like, my first month or two, like, I thought about dropping out. And I told one of my friends that I was going to drop out and that I just was going to go back home and maybe go to a smaller college where like maybe I should have been the whole time. And it took me a long time to like convince myself that like I belonged where I was and that I could do well where I was. There's a whole process to that, right? From obviously working hard and doing well in classes to like talking to people about it. And so I've definitely felt the imposter syndrome, sometimes more than others. Um, but my final message to that question is that while we all do feel it, we all also do belong where we are.
Yeah, thank you. And I know you mentioned like your mom is a very optimistic person and that you had kind of that support from your parents and like believing in you and your success. Um, can you speak to like having or kind of as a first gen student, how you kind of connected those like dreams or like the support from your parents to like what you were trying to accomplish in school?
Yeah, yeah, great question. I think yeah, my family, my parents, and I'm super lucky for this, but they've been pretty supportive. Like they didn't know for the longest time what I was doing. And I don't know if they still know exactly, with all this business policy stuff, what it is that I'm doing or trying to do. But they have been like supporters throughout, and I think that's been super helpful.
Have they
Um,
ask
so
have they ask you have they asked you when you're gonna start having a paycheck?
having what? Sorry.
How often do they ask you when you're gonna start getting a paycheck?
Oh, it's interesting. Not often, and I think that's another thing about them, right? Like they have always, when I told them, maybe they thought it. I'm pretty sure they did, and I definitely, with my first paycheck, my first stipend, basically gave it all to them. But they never like pushed me on that. They never like asked for things. And I think I really appreciated that from them. Like when I told them I'm going to take another 3 years, it wasn't that there was no pushback at all. They like believed in what I wanted to do, and so that was so helpful. But just to quickly round out that question, Lucia, I think going back to what I said at the beginning, right? Like seeing my parents and their experiences and them really suffer from a lack of support and resources influenced like what I want to do. Not just them, but like friends, community members as well. And so, my hope is that one day I can make their lives better and the lives of others like them.
Yeah. And I think, that's reflected in your decisions in terms of your training and your career as well. Thank you. And we do have some questions regarding your different like degrees and that kind of thing. So someone asked, what was your favorite business course or class that you found helpful in terms of its application to medicine?
Yeah, great question. There were a lot at business class, in the business school in particular. Um, there was there was one class I took called the role of government in the market economy. It was basically like and it wasn't on healthcare specifically. It was like on this big question of what should the role of government be? And what should the role of like a market economy be? And we talked about healthcare, like in some cases, but we also talked about like immigration and housing and other issues like or other topics like that. And so I think that class was super helpful because, really like our healthcare system, when we think about it, um, has so many different entities involved, right? From our government, who administers Medicare, Medicaid, CHIP, veteran care, and so forth, to the private sector, right? From private insurers to private hospitals, and more. And then we have like nonprofit groups too that are doing amazing work. And so I think that class was super helpful in helping me think about, how much should government do? Like what is their proper role? And I wouldn't say we came to an answer for that on any case, right? It was a lot of discussion just to like help us think through things, but it was a super helpful exercise.
Yeah,
Yeah,
that's super.
oh,
Go ahead.
sorry. Sorry. And the only thing that I would just add is healthcare is the most regulated entity in the US. And so it touches policy, law, government more than anything else. And obviously business too. I mean, that's kind of the big challenge in American healthcare is business plays a big part in it. Um, yeah, and so I think that that's part of it. But so were you able to like when you were in business school, were you doing the full um business school or were you doing like a more accelerated courses in business?
Yeah, great question. It was kind of the same, kind of accelerated. Basically, what I did was a 3-year program that combined the MBA and the Master's in Public Policy. Typically, the MBA is 2 years, and the Master's in Public Policy is also 2 years. So it is, if you add them together, 4-year program, but we did it in 3 years because it was combined. But a very similar experience. Like you take all the same classes your first year at the business school as everyone else, and you take all the same classes your first year at the Kennedy School of Government like everyone else. The difference is that we have less elective time essentially. So we have a third year where we take elective courses at both schools, whereas if you were doing the programs independently, you would have a little bit more time for electives.
Okay, that's super interesting. And I know you mentioned like learning from your fellow students and like peers in undergrad. Do you feel like getting exposed to these different cohorts of students that were, not necessarily healthcare related people influenced or will continue to influence your practice and your perspective?
Absolutely, 100%. And there were many cases where I disagreed with my classmates, and we would go back and forth in class, with what I believed in versus what they believed in. But there were also cases where, people would say something and they would change my mind. And that was for both the business school and the government school. And so I think one of the special parts about those schools is that often there isn't one right answer. At the medical school, there usually is, right? There's like, okay, this is probably the diagnosis. This should be the right answer. And this is probably the treatment that should be the right answer. When it comes to business or government, right, we can argue for days and debate for days on, what is the right answer in terms of, the role of the private sector in healthcare, right? Like, I don't know what the right answer is. Maybe some people do, and I want to talk to them, but I don't know personally. And there are so many different topics like that where everyone has a slightly different opinion, and where debate, is really, really super helpful.
Yeah, and um, maybe you can speak like, well, we have one question about why you decided to go to Harvard Med School, and then maybe after that you can also speak to how you decided on this master program instead of maybe like a master's in health administration or in public health
Mm.
or yeah, so kind of a two-part.
Yeah, definitely. So the first question as to why Harvard Medical School, a couple of reasons. One, the it's something that maybe a lot of you will think about, but like financial aid. Financial aid is like something to think about, like when you're making that decision, right? Some schools are more generous than others. And Harvard was pretty generous. They weren't the most generous when I was receiving offers, but they were very generous. And so I think that definitely helped my decision making. Number two, I found that the students at Harvard Medical School were super diverse in terms of where they came from. Unlike some other schools, like some state schools in California, I was looking at UCSF, at the same time, and I noticed like a lot of students at UCSF came from California, which is not necessarily a bad thing. But when I looked at HMS, they were kind of coming from various different places, and I wanted more of that experience since I had been in California my entire life. And so that was another thing, the diversity of students. The third thing, when you are accepted to medical school, there are often revisit days. So after your interview, you can kind of go back to the medical school. I assume they still do this, probably virtually, and you get to meet the people who could be your classmates. And I came to mine at HMS in 2017, and I met amazing people. And I'm pretty sure I would have met the same, similar amazing people elsewhere. But I was really, really happy with like the folks that I was meeting. And so that I think made my decision easier. The fourth thing is, Harvard, I knew would give me the opportunity to think outside the box a little bit more. Harvard Medical School is right next to the Harvard School of Public Health. Harvard Business School is across the river, or not even across the river, down the street. Harvard Kennedy School across the river, right? So many other graduate schools that you can kind of combine your education experience with, or at least learn from. At the time, I didn't know what I wanted to do in terms of the other dual degrees, but I knew that the opportunity was there, and I liked that. Uh, and then I think those are like the main reasons really. And then that kind of dives into the second question of the dual degree programs. So for those here, so I kind of just looked at Boston programs. Is maybe how I should preface that because I didn't want to leave Boston. I wanted to be able to combine my education with HMS and like have that work somewhat seamlessly. And so that means I was limited a little bit, which wasn't a problem for me because I knew that it was the MPP and the MBA that I wanted to do. How I knew that, the MPP I think was maybe the one that is a little bit more interesting in how I decided, because many people here will do like a public health degree instead at the Harvard School of Public Health. I like thought about that, and I think it would have been a great choice. But I wanted to, a understanding of things outside of health that like often aren't even connected to health, but that I kind of know are. So, for example, at the Kennedy School, like we learned about tax policy, right? And that's not something that you're probably going to learn too much of at a public health school, I assume. And that's what I heard from people who had done the MPH degree. But I wanted to learn about tax policy a little bit because I feel like tax policy does affect, the people and the communities that I grew up around and how they live their lives and how they can be healthy. Um, Same thing with like housing. While housing nowadays is definitely talked a lot about, like in the health circles with housing and health, housing policy alone is something you can learn at HKS. How do like local zoning rules work and so forth, like things like that, which maybe you can get into at some public health schools, but not into the same kind of detail as maybe some public policy schools. And so that was kind of the distinction I made. I wanted to know more about these other things, whereas at the public health school, we would really just focus on health, which includes a lot of things, but maybe not as broad as HKS. And then the business school, I think, was an easier decision. What I wanted from that degree was leadership and management skills. I wanted to become a better leader. I wanted to still be a better leader. Um, and I also wanted to learn, more about like the finances stuff. Like, you often hear a lot about, oh, we can't afford this, or this doesn't make sense. There's no return on investment here, and so forth. And I wanted to know more about that so that one day I can have, intelligent conversations about those topics. And so that was kind of the decision making around the two degrees.
Yeah, I think one of the biggest challenges, I've worked in healthcare for a long time, for a long time, and the the idea is always comes to, in which I want to like pull the no hair that I have on my head whenever I hear that from. It's like, oh, it's not, it's there's not a good return on investment, or it doesn't make business sense. And it's like, really? Like, one of the things working in the ER is I got a lot of patients, certainly, definitely, that are not on the income scale, they're on the lower and usually underrepresented. Um, I have this one case is I have a couple patients that come into the ER because their blood sugar is spiked too high, and it's like, well, why is it? And they're like, well, we only get 30 cuvettes for our diabetes, and we can't check it multiple times a day because our insurance, or only pays for 30 of them, and they only do it once a day instead of like good diabetic management is doing it too. So they come in with a sugar of 800, and they spend a couple of days in step down, or sometimes they go to ICU. And so to me it's like, well, how does that a return on something that costs $15 a month versus $15,000 a day in ICU? That's like a really not. But and so to me, I've just never understood the business part of it, and it's always interesting to say, like, and a lot of decisions are made by people that have no healthcare. They're mostly MBAs, so that always, the highest paid employee in our hospital is the MBA who's not a physician, that is the highest paid and has the most decision. I have a really, really important question, and this is like life and death. Are you a LA Dodgers fan or a Red Sox fan?
Uh,
Because that is
that,
the most
that
important question here.
that is not where I thought you were going with that. But I am proud to say that I am an LA Dodgers fan, and a LA Lakers fan. You can't take the LA out of me, sadly, for some people, but fortunately for many others.
Well, that is a big question, being a Dodgers and Lakers fan. Although the Lakers have last couple of years have not been where they should be, but
Yeah, we'll be back. We'll be back per usual. Just a matter of time.
yeah. But that was like probably the most important question here, because that.
Thank you for the question.
Yeah. Um, so now hopping back to some of the other questions in the chat. Um, and you can, go out. These are big questions, so as into depth as you feel. But someone asked, do you believe that the US should adopt a universal healthcare system in order to help address systemic inequities in healthcare outcomes?
Yes, definitely we need universal health care. I think everyone in the US should have health insurance. Sadly, that's not the case. It did get better over the last 4 years or so with a lot of the provisions under the Biden administration, but it's still not perfect. Like 8% or so of the United States population is uninsured, and many are underinsured. So even if they have health insurance, they can't really do much with it because their copays, deductibles, i.e., the amount of money that they have to pay in is too high. And so we definitely need a better healthcare system that, one, ensures everyone in the country, and that two, gives them good health insurance, not just a card that says you have health insurance but you can't do anything with.
Yeah. And that kind of goes into the next question, which is, what are your thoughts on how the current political climate's going to impact or is impacting healthcare, and if there are any specific issues or policies on the ballot that you think are going to make a big difference?
Oh man, this is a big question. I feel like we need to sit down for like a whole nother conversation to discuss this stuff. But I guess what I'll say is, I mean, there's so much, but absolutely. I mean, the current political climate, and I mean the election, right, is going to affect what happens in the next not just 4 years, but really in the next decade or more when it comes to healthcare and health. Um, So it is very important. I think everyone here is close to, or everyone is probably voting age. If you are voting age, please go and vote. We need everyone to vote, regardless of what your beliefs are. It's a very important duty, I think, of all of us, and so I highly encourage you to do that. Um, I think the one other thing I'll say is there have been I don't want to get partisan here, right? But there are definitely differences when it comes to the two candidates on the ballot. And if we look at what the two candidates have at least espoused over the last several months or so, I feel like one of the candidates is more committed to expanding the current healthcare system that we have, right? From the extending the ACA. So we know that in the last 4 years, more people have been insured because of subsidies through the Affordable Care Act. That includes my parents, actually. My parents got health insurance recently because they were able to afford it because of those subsidies. Um, and the Harris-Walz administration wants to continue that and kind of continue to get people insured. So that's kind of that one platform. And there's more, right? Negotiating prescription drug prices, making sure people don't have to pay a ton for insulin. A lot of different policies like in that camp. Um, in the other camp, I'm seeing almost the opposite, where the at least the GOP in general is talking about maybe repealing the ACA, going back to a world where where insurers can discriminate based on pre-existing conditions. Um, and also to a world where we don't have the negotiating power that Medicare now has. I don't like that world, to be quite frank with you. And I don't want to get too partisan, but like I believe in a world where everyone should have health insurance. I believe in a world where people shouldn't have to, use their entire paycheck to get the insulin that they need so that their diabetes is controlled. Like I want people to have health insurance. I want them to have those medications that they need. And so I think there are clear differences. The current political climate and the current election are going to determine, how the next 4 years and more look. And so it's very important for all of us to vote.
Yeah,
Yeah.
and I think politics and policy, has probably the greatest impact on health outcomes than anything else. I mean, the reason why we have a huge physician shortage is because we have not increased funding in residency from Medicare since the 1990s, before when we were, two-thirds of the population that we were. And so that's one of the politics. And people love to say, oh, well, I don't like politics, or oh, politics. It's like, that's great. You may not like politics, but you know who loves politics? Your landlord, your oil company, your boss, the hospital that you go to, your school, everybody around you loves it, and they love the idea of you not being involved and engaged and knowledgeable, because they will use that politics to basically screw you over, because that's the entire, and so, if you're not at the table, you're not making the decisions. And unless you want to run for, something, which you should, but at the end of the day, you make your power at the ballot box. That's how you influence your power. And that's where you have the most power. And people say, oh, well, government doesn't this or this. It's like, those who don't show up, you know, can't make the decision. And they know at the end of every election, they will look at it and say, oh, 18 to 24s or 18 to 29 people didn't show up. So when it comes to student loans, or it's like, well, they're not going to do it because there's not going to be consequences for their actions. But if you hold them accountable, then you'd be like, okay. And if you're engaged and see who makes those decisions, and it's not just at the top. I mean, a lot of the decisions that impact your day-to-day life is at the local level. And if you're only showing up every 4 years, and you can't complain. I mean, and that's my biggest part of it, is that, politics is a contact sport. And if you're not in full contact, then, you know, not only you can't complain, but you will be harmed by it. So
Thank you, both Juven and
Yeah,
David, for
they get me on the high horse on that one because I get really worked up on that.
yeah, valid. So we have some remaining questions that are kind of on different topics. So if that's okay, we'll be bouncing around a little bit. But we have one question that says, I'm currently a high school student with plans to attend UC Merced's BSMD program. I come from a single mother household, and I'm often left thinking about how to pay for college without being a burden on my mother. How did you afford to pay for college considering your upbringing? And yeah.
Yeah, great question. A couple of things that helped. One was USC was generous with their financial aid. So, you know, look into UC Merced's financial aid program, see if they have like grants, scholarships, things like that that you can apply to, if they haven't already offered you some already. So that's one. Two, and this is easier said than done, but during my junior and senior year, I did work like part of that teaching role for organic chemistry. But that was paid for. They paid me for that. So I was paid by the hour to teach and to help like the instructors teach the students. And so that definitely helped me save, a little bit of money, be able to pay some of the bills. Um, but it's really hard to do, of course. And, especially as like a freshman, when you're like still trying to figure out this college thing, like it's really tough to do. And if you can afford not to work, then, try not to that first year, so that you just kind of get used to doing well in school first. And then the third thing, loans did help. So one thing I'll say about loans, when I was in college, like I remember, looking at some of the loans and I was like, wow, this is like a lot of money. I don't know how I'm ever gonna pay this back. And and something you realize, like as a, you're going to college, so you're probably around like 17, I'm guessing. Um, money, I think like to me, like when I remember getting a loan for like, I don't know, $2,000, $3,000 or something for like that first semester. And I was like, wow, like that's a lot of money, like that's crazy. And now like as a resident and you're working, you're earning some money, not a lot. Right? They don't pay us a lot as residents. So know that. But like that was not a lot of money in retrospect. Like it definitely feels like a lot, right? And it is a lot of money to many people. Like when I send my parents money, like $800, $1,000, like that is a lot of money. But if you are committing to this path of being a doctor, but you believe in yourself, you put in that work, and you get to medical school and then to residency and so forth, you will be able to pay off like those loans that you take out. Now, if we're talking about, oh, I need to take out like a $50,000 loan like each semester or each year, that is a lot of money. And definitely look at the interest rate and all the terms associated with those loans and make sure you're getting, loans from a trusted partner, probably your institution, if possible, not, some private party that may be less trusted. But point being, like, don't be afraid of some loans because if you do commit to this path or, some other adjacent path, it shouldn't be too much on you in the back end.
Can I
Yeah, go ahead.
can I just add one thing? First of all, congratulations. That's like a really competitive program to get into. Second, don't ever think that you're a burden to your parent, to your mom. She sacrificed a lot for you to be where you're at. And so you're not a burden, but you're also going into a career that is going to reward you pretty well. I mean, you're going to be in the top 1% of income earners when you're done with your program. And you are going to be able to do a lot of things for your mom that you can do as a physician that in other careers is going to be more challenging. In California, I think the average to buy a house is around $600,000, and most people graduate from college and make 85,000 a year, and they take out a loan to buy a house. Whereas as a doctor, yes, you're gonna wait a couple, probably 10 more years, but your first year out, you make $250,000. So the income and your income goes up higher every year. And so you're not going to be a tech billionaire. I mean, if you want to be a tech billionaire, go do a startup and, become that. But you're going to have a career that is going to pay you well. You're going to be respected. I mean, your mom's definitely going to be proud of you. But the other part of it too is that the unemployment is so low that the Department of Labor and Statistics doesn't keep track of unemployed doctors. So you're going to always have that job and have job security. Now, granted, you may not be able to be a plastic surgeon in Beverly Hills, but that's going to be a little bit more competitive versus so I would say, think more about how you're going to be able to succeed, how you're going to be able to, you know, do you want to do this career? Do you want to put in the hours? Do you want to make the sacrifices? I think those are the harder questions. Money should be, and I'm sure Dr. Velasquez would admit this. Even some of your rich friends at those schools are taking out student loans. They're not paying cash. You know, they're taking out student loans and they pay for it over the year because once you're in school, you don't incur interest. So obviously those are federal subsidized loans, but still, even the rich people take out student loans. So no, but I've, even, so I see very few people that pay, you know, cash, every year for their school. That's just my opinion, but
Yeah.
but
Thank you.
congratulations.
Um, and so this is kind of talking about a different way that schools may support students, but um, do you feel that Harvard Medical School supports students when they go through mental health issues or if they have to take a leave for another reason?
Yes, they do, and they've gotten better at it too over the years. It was better when I finished medical school than, excuse me, than when I started medical school. And typically that means like, sorry, that they'll be able to connect you with like a therapist, if that's something that you need at pretty much no cost. Um, and it's coughing. So, but that's my short answer. Yes.
Perfect. Thank you. Um, and okay, so we have one last question from attendees. So make sure if you have any other burning questions, you send them in. But do you think there was something in your medical school application that set you apart?
Great question. I think going back to something I said earlier, um, people were kind of able to look at my application, I assume, and say, okay, I think that this person is really passionate about working with underserved communities, and unclear how he's going to do that beyond being a doctor and going to work for one of these communities, but it's clear that he's very passionate about that, and we can tell because of his life journey to date, and because of the experiences and what he committed to during college. And so I think that's probably something that made me stand out. Of course, this kind of goes without saying, good grades, good MCAT score, that stuff also helps. Um, but I think what makes you stand out is typically not that. And it's more about your story, your journey, why it is you want to be a doctor. And I felt like through my personal statement, they could really see that as well.
Yeah. And looking towards the future, do you have any plans for post residency? I know you're probably pretty occupied with the current state of everything, but do you have any plans in terms of fellowship or what specific areas you would want to work in communities?
Yeah, great question. I definitely want to work like in an underserved community, and so that's something I'll be looking a lot at once I'm applying to jobs in a couple of years. Um, the other thing that I'm currently thinking about is primary care and hospitalists. So what does that balance look like for me? I could see myself doing both, doing either. I tend to like a lot of what I do in the hospital every time. I was on the oncology ward a couple of weeks ago, and I really like oncology. I don't plan to do a fellowship to answer that question. I think I'll be a generalist when it comes to the clinical part of my work. But I do like a lot of what I've seen, and I do keep my mind open. But at this point, I'm thinking general medicine in an underserved community, either at a safety net hospital or a hospital like that, and or like a community health center kind of clinic. And at the same time, hopefully, I can do the policy work as well.
Yeah.
Dr.
And go ahead.
Go ahead, go ahead.
I know you mentioned that you had this goal as you were pursuing your MBA of learning how to be a better leader and to continue to integrate that into your practice. How do you hope, or do you hope that you can inspire, I mean, as you're doing now by talking to pre-meds and people in different parts of their journey, but that you can be a leader within your goals and your field for other people like you or who may resonate with the same goals as you?
Yeah, I mean, I certainly hope so. I hope that I can be, a leader for many folks, and just hopefully inspire some hope that, regardless of where you come from, you can do what it is that you dream of. And yeah, I hope I can do that by talking to people right through events like this, by being vocal about the things that I care about, um, through my writing. That's something that I tend to do. I tend to advocate for um, on issues that I believe in, on topics that I believe in, and so I hope that I can continue to demonstrate some of that leadership, like regardless of what I'm doing, whether it's writing, whether it's working in a hospital or clinic, or working in some policy role.
Thank you. Oh, Jubin, you have.
I have two questions. What is one advice you would give yourself when, if you could go back in time today, what is one advice would you give yourself to when you're a pre-med student, as many folks are not right now?
Yeah, great question. I think maybe there are two. The first one is, find your people. I think when I was in college, I focused maybe a little bit too much on the textbooks, on like making sure that I did very well in the classroom, and it definitely helped, and I think I needed to do a lot of that. But it was often at the expense of spending time with the people around me who, were very special to me, but that sometimes I didn't get to know to the degree that I wanted to because I made this trade-off. And so I would say, when you're in college, or right after college, do spend that time with those people around you that are going to be, your biggest cheerleaders, right? That are going to be your support system. I got way better at that once I came here to medical school because I needed to in order to survive almost. And my friends were also really good at telling me I needed to do that. So that's the first piece. And then um, I think the second piece, and I sort of mentioned this earlier, but back when I was in college, or pre-med in general, I didn't really know that I could be a doctor who does these other things, right? From like writing to a policymaker and so forth. My idea of a doctor and going to medical school was you're a clinician and you see patients, or you're a clinician and you do hard science research at the bench or in the clinic. Those are your two options. That's what I thought. No one told me that you can be a doctor and a policymaker. No one told me that you can be a doctor and a leader in like a health system organization that you believe in, or that you could be a doctor and a writer, or these other things. Like no one told me that. I didn't know that, and I wish I knew that back then, because then I think I would have explored some of my other interests that came out later in my career.
And then my second question would be if you could go, I think you answered it a little bit, but if you could go back and do something differently in your pre-med journey, what would it be?
Yeah, I would have spent a little bit more time with the people around. I think that's what I would have done a little bit differently.
Awesome. Well, it's almost 11:30, so if you have any last minute questions, please drop it in. But if not, Dr. Velasquez, I'm sure is post call so he could go enjoy his Saturday. It seems to be nice in Boston, so
Not too cold, thankfully. A little chilly, but maybe for for the Californians it'd be pretty cold. But
yeah.
this has been super great. I'm happy to answer any last minute questions, but um, in the absence of that, I'll just tell everyone that's on right now to continue forward. If this is something that you want to do, if you want to be a doctor, you can do it. And I know it takes a lot of time to really internalize that if you come from a background like mine. But continue to tell yourself that, continue to work hard, continue to build that support system. And I think at the end of the day, you'll be rewarded with the outcome that you're hoping for. And that means, like, to some of the questions, you'll be able to support family. And I've already, even like with that first stipend that I sent, I felt it wasn't enough and it won't ever be enough. But it felt really good to finally like be able to do a little bit of that. And I know others that are older than I am have similarly told me about their experiences and how it feels really nice to finally be on the other end of it. It's hard as a pre-med, very hard, a lot of uncertainty, um, but it's not impossible. And I think if you come from where I think you come from, then you've already surpassed a lot of obstacles and you are well on your way to surpassing even more and getting to where you want to get.
Well, Dr. Velasquez, I would add that you are your family's wildest dreams and hopes. So thank you again for making time for us post call, and I really appreciate it. And thanks everyone for coming. And everybody enjoy your weekend and make sure you vote, 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 vote. So.